Hello and welcome to the GAP MASLD MASH Community Network. This is sponsored by Madrigal Pharmaceuticals. My name is Lisa Richards. I'm a board-certified nurse practitioner and I practice at UC San Diego Health in San Diego, California. I would like to invite you to use this QR code to record your attendance for this meeting. So this program today will be focusing on MASLD pharmacotherapy. Before March 14th, 2024, the treatment and management of MASH and MASLD were lifestyle modifications and comorbidity management, that is trying to optimize comorbidities. So we focused on weight loss, looking at lifestyle interventions with diet and exercise to help control obesity, weight loss medications, and then those patients that were needed for bariatric surgery, we would refer them. And again, as I mentioned, we wanted to co-manage their comorbidities and optimize treatment to reduce cardiovascular risk by making sure their diabetes was well controlled, their hyperglycemia. We focused on patients to have A1Cs less than 7. Their hypertension and dyslipidemia were well controlled. And all of this was focused on the treatment for dysmetabolic or metabolic management. Then we had the GLPs, which are the new kids on the block that everyone's aware of. And the GLP receptor agonists and the GLP-GIP receptor agonists aided in weight loss management for our patients. We will be talking about the GLPs in just a moment. And then we looked at treating NASH or MASH with vitamin E, which we'll talk about in the Pivens trial, along with pioglitazone. And then we'll focus more on the new medication that came out in 2024, resmetirom. So let's dive a little bit deeper into the GLP receptor agonist. Now we know that GLP-1 is an endogenous hormone in our guts, and we know that it directly acts on the hypothalamus to promote satiety or fullness and reduce energy intake. And this is achieved through stimulating glucose-dependent insulin secretion, suppresses glucagon, and most importantly, delays gastric emptying. So our patients feel full, so they don't eat as much. These GLP receptor agonists help with this endogenous GLP, and it lowers blood glucose and causes weight loss. Now, semaglutide 2.4 milligrams was studied in the Essence trial, which was a phase 3 double-blind placebo-controlled study for those patients that had stage 2 or 3 liver fibrosis. And semaglutide successfully met both primary histological endpoints at 72 weeks, showing significant MASH resolution without worsening of fibrosis and significant improvement in liver fibrosis without worsening of MASH. And this was statistically significant. So our patients that have MASLD, many of them are overweight or obese. So you may want to consider administering or prescribing GLP-1s for these patients. And of course, this is not for patients that have lean MASH. In practice, the GLPs affect hepatology and GI providers because it delays this gastric emptying. And this is important because we order a lot of procedures, specifically EGDs and colonoscopies. And because of this delayed gastric emptying, it puts the patient at risk for aspiration during anesthesia. So in my practice, we ask the patients to hold the medication for 1 week prior to their procedure. I mentioned earlier about the Pivens trial, and the Pivens trial was a landmark study looking at vitamin E pioglitazone versus placebo. And it looked at patients that were non-cirrhotic and non-diabetic who had MASH. Patients were given 800 units a day. And it looked at the effectiveness of those patients that had histological improvement. And what the Pivens trial showed was that 43% of the patients did have histological improvement. That is, improvement with their steatohepatitis. However, they did not have liver fibrosis improvement. And because of this, when you look at guidelines, they differ in their recommendations. ASLD guidelines suggest vitamin E may improve MASH in non-diabetic individuals. However, the EASL guidelines do not recommend vitamin E therapy for MASH patients because of the limited efficacy on fibrosis and the potential risks. So we know with vitamin E, there's an increased risk of bleeding. This is important, especially in our patients that have uncontrolled hypertension. So if a patient has uncontrolled hypertension, they could be at risk for a stroke and bleeding, and therefore this is a patient I would not prescribe vitamin E for. The other consideration is those patients that have prostate cancer or first-degree relatives with prostate cancer. Again, vitamin E would be contraindicated for these patients. And then there's some considerations, that we need to be aware of just for long-term use of high-dose vitamin E. Pioglitazone in the Pivens trial showed no benefit over placebo. However, it did show some secondary benefits in cardiovascular risk. Pioglitazone was given to patients that had MASH, and the difference between pioglitazone and vitamin E is that pioglitazone could be given to those patients with or without diabetes. So as you recall, vitamin E was without diabetes. They were given pioglitazone 30 to 45 milligrams a day. Now, there were some safety concerns, and they included potential risks of weight gain. Now, this is important because if I'm working with a patient that has MASLD, that's overweight or obese, and I give them a medication where they potentially can gain weight, they're not too happy about that. So that's something to consider. Also, peripheral edema is a concern and bone fractures. So I would be concerned about giving this to patients that are postmenopausal, perhaps, that have osteopenia or osteoporosis. And then also there's a possible association with an increased risk of bladder cancer. So really you want to carefully consider these patients when you're putting them on pioglitazone. The FDA approved resmetirom under accelerated approval on March 14, 2004, in conjunction with diet and exercise for the treatment of non-cirrhotic patients that have significant to advanced fibrosis, that is stage 2 or stage 3 fibrosis. Resmetirom is a thyroid hormone receptor beta agonist, and it selectively binds to and activates the THR beta receptor in the liver. So let's take a little bit closer look at that. So we know TSH regulates many metabolic activities in the body, including glucose and lipid metabolism in the liver. THR beta is the predominant isoform in the liver and is vital to maintain normal lipid regulation and mitochondrial function in the liver. And those patients that have MASH, the THR beta is impaired. So what resmetirom does is it's a THR beta agonist that selectively targets the liver and helps regulate lipid metabolism. By reducing liver fat, resmetirom indirectly decreases inflammation associated with MASH and decreases liver fibrosis by activating the hepatic stellate cells and decreasing collagen deposition. So in the ongoing Maestro-NASH phase 3 randomized trial, this trial looked at patients that had biopsy-confirmed MASH, that is, they also had to have biopsy confirmed stage 1B fibrosis, stage 2 fibrosis, or stage 3 fibrosis. So these were non-cirrhotic patients. This trial consisted of 966 patients who were randomly assigned into a 1:1:1 ratio to receive once daily resmetirom 80 milligrams, 100 milligrams, or placebo. The two primary endpoints at 52 weeks were NASH resolution, including a reduction in the MASLD activity score by 2 or more points with no worsening of fibrosis, an improvement or a reduction in liver fibrosis at least one stage without worsening of the MASLD activity score. What you'll see here is the phase 3 safety data, which is quite important for us to be aware of what type of side effects were experienced with resmetirom. And you can see here it was primarily gastrointestinal side effects. So when you look at diarrhea and you look at the resmetirom 80 and 100 milligram arm, you can see that this was higher than placebo. The same was true with nausea. When you look at the 80 milligram and 100 milligram arm, those were higher than placebo. Most importantly to me, when you look at the serious adverse events, this was pretty equal among all the arms. And specifically, if you look at the placebo arm here, it was higher than the resmetirom 80 milligram arm. So what this tells me is that this medication was safe compared to placebo. The other primary endpoint that we looked at in this trial was MASH resolution with no worsening of liver fibrosis. And again, if you look at this in the 80 milligram and 100 milligram arm over placebo, you can see that it was statistically significant in meeting its primary endpoint. And then those patients that had fibrosis improvement by at least one stage with no worsening of MASLD activity score, you can see here that again, it was statistically significant over the placebo arm. So there's some practical considerations for managing MASH with resmetirom. First off, you want to make sure that you have the ideal patient. And again, remember, these are patients that have significant to advanced liver fibrosis, that is stage 2 or 3. Resmetirom is not used for patients that have cirrhosis. And again, this medication is FDA approved in conjunction with diet and exercise. Some other considerations when you're prescribing resmetirom is drug-drug interactions. And this chart I actually keep in clinic with me. It's very helpful. And you can see here on the left-hand side of the slide, medications to avoid. So you cannot prescribe resmetirom if these patients are on these medications here. Now, medications tolerated but require resmetirom dose reductions are these medications here. And what I would bring to your attention is many of our patients may be on Plavix, so you need to have that consideration that resmetirom dose will need to be reduced. Medications at risk of increased exposure due to resmetirom, that is, these medications here. So you want to monitor for side effects that are known with these medications. Probably what's most important to me and what I have to focus on a lot in my practice is statins. Many of my patients with MASLD MASH are on statin therapy, and that's fine. However, what you need to be aware of is that there are dose-dependent concerns that we need to be aware of. So the highest dose of statins are here: pravastatin 40 milligrams, simvastatin 20 milligrams, atorvastatin 40 milligrams, and rosuvastatin 20 milligrams. So this is the highest dose of the statin that they can be on if you're prescribing resmetirom. Now, what I've had to do several times in my practice is reach out to the cardiologist or the primary care provider and find out if they're on higher doses of the statin, if it would be safe to go ahead and lower that dose before we start resmetirom therapy. Other practical considerations for managing patients on resmetirom is duration of treatment and monitoring. So this is ongoing in the Maestro-NASH trial, where they're looking at the optimal duration of treatment and monitoring parameters. Likely we know that we're going to need to restage patients using non-invasive tests such as vibration-controlled transient elastography, CAP, protein density fat fraction, or ELF, to help us look at efficacy. And again, expert panels are looking at cut points right now. I would refer you to MASLD guidelines because there are some guidance on looking at efficacy and monitoring parameters. Some other practical considerations for managing MASH with resmetirom is insurance. Right now it's through specialty pharmacy, so it's unclear when there's widespread use of resmetirom insurance coverage. And as I mentioned earlier, staging will need to be a consideration, and lab testing for monitoring patients and looking at efficacy. And again, there are some guidance at ASLD. Duration of treatment recommendations, this will be looked at in the ongoing trial. And as you're aware, there are multiple agents that are currently in clinical trials for our patients with MASH. So we have a bright future ahead, and we'll have more options in the near future for our patients with MASLD MASH. So this concludes our discussion on MASH pharmacotherapy. I would like to invite you to visit the GAP MASLD MASH Community Network to view MASH disease states by utilizing this QR code. And we also have some Rezdiffra promotional programs. I'd like to thank you for your attention during this program. Thank you.